so stupid.
What is that? Oh, look at all this stuff. This guy's got everything.
What you do here is different than just like a regular chiropractor, right?
I'm a board-certified chiropractic neurologist and a functional medicine practitioner. So I bring a lot of different training to every single patient's experience. So when I look at somebody, I'm thinking not just about one thing. I'm thinking about, well, what might be the cause of whatever it is that they're coming complaining. So for instance, somebody could come in here complaining of neuropathy, right? Which is a pathology of, or what people experience is numbness and tingling in their feet, or sometimes pins and needles, or sometimes some pain in their feet. There can be a variety of different causes. Some people, have it because it's as a consequence of stenosis in their spine, which is a narrowing of the spinal canal. Some people have it because their nerve is trapped somewhere in the pathway. Some people have it because they've got a metabolic disorder, because they've got like diabetes or they're pre-diabetic. Other patients have it because it's autoimmune in nature. So until you can dissect and tease those things out, you don't really know what's the appropriate treatment for the patient. So I'm not just in here looking at them going, oh, well, that's a spine issue. It could be, but it might be something else too.
I see. Okay. So how does someone know to come to you? Because I think generally when someone feels pain or they're sick, right, they just go to a clinic and they're like, hey, what kind of medicine can I get for this to numb the pain? You know what I mean?
Right.
So
Right.
how would someone, I guess, decide that they need to come to you?
Probably through a conversation like this and then
Okay.
seeing me talk to somebody like you about it, right? Because it's a matter of information and what people are used to. Most people think like, I have something wrong with me, I go to my doctor, my traditional MD, right? I mean, a lot of people go to chiropractors because they're in pain, they go to physical therapists, they do alternate things, but oftentimes they're sort of like gateway, or their gatekeeper is going to be their general practitioner, somebody they've been seeing for a bit. Younger people, not so much, right? People who are in their like 50s, 60s often have like a doctor they've been with for many years. So they'll go there first. And typically what happens if they have back pain, because their toolbox is somewhat limited, is the doctor will probably do a very limited exam, if an exam at all, and then say, oh, here, here's some baclofen, or here's a muscle relaxant, right? Or here's a painkiller. And then they never see the patient again. Why? Because that didn't work for the patient. And they think, oh, that's what works in their mind. Like, they didn't see the patient again, so they must be better. Or maybe they'll refer to a chiropractor. Maybe I have MDs who refer to me all the time. Or maybe they'll refer to a physical therapist. So, or sometimes people just look for a good chiropractor, right? And it's hard to say what, how people would find me. It's
Social media.
social media. It's not terrific. But really these days, we're like, it really is a lot of social media, having your name out there and your presence out there. Obviously referrals, we get a lot of referrals, but in terms of like new patients going, well, why would I come to you versus somebody else? You'd have to look at, what are you looking for?
Mhm.
Right? Are you looking for a Band-Aid, or do you want to get to the root cause of the issue? If you're looking to get to the root cause and really unravel it, that's the world I live in and work in.
Interesting. Okay.
Years ago, I had a patient who came in here, he had me talk to their doctor, who was actually in Johns Hopkins. This is like probably 20 years ago. And I was talking to him and he said, oh, we never even look at root causes until like several trials of like symptom care doesn't work. Right. That was kind of my reaction too. Like, wait, what? So in the world of medicine, it's like they're just looking to do symptom care. And it's what we've been trained to. You watch like advertisements on TV. I remember when I was a kid, right? It was pop, pop, fizz, fizz.
Yeah.
Or what a relief it is for Alka-Seltzer, right? And I'd be looking at the TV like, just don't eat the pepperoni pizza unless it's on the bag. You don't need the Alka-Seltzer, right? Simple problem solved. But that's the world we live in. Of years ago, I had my office manager was with me for about 15 years, and she was a gymnast, and her thing was the balance beam. She was an NCAA ranked gymnast. Fantastic. So as part of training her, I did an intake with her, like, neck pain, get ready to get any headaches. And I go, remember headaches and neck pain after being a gymnast, really? And she's like, no. I mean, she goes, I take Advil 4 or 5 times a week. I said, what do you take Advil 4 or 5 times a week for? And then like a light bulb, she goes, oh, I guess my headaches. Right? Isn't that funny how we just get like unconsciously sort of
Used to pain.
and like, this is what I do. And but that's not a
Right.
thing. So we corrected the curve in her neck, and she never had headaches again, never had any neck pain.
Yeah, I think we're just taught to ignore that and just focus on other things. Okay, that's handled. Let's
Culturally, that's how we all,
Yeah.
right? About like everything. Find a way to numb yourself from what you're experiencing. But what you're experiencing is your body's way of saying to you, hey, pay attention over here, something's wrong. And then the solution typically is I take an Advil, I take a Motrin, I take a Pepto-Bismol, I take an antacid. It's something like that.
And I think a big part of that is us not wanting to do the work to change, because there might be some things that we uncover that we don't want to look at and we don't want to change.
certainly like in terms of like your day-to-day routine, and certainly in terms of psychology. And I think what comes up for people too is like, well, now I got to commit to doing something. You're
Right.
talking about now I got to spend some money on it. Now I got to spend some energy on
I
it.
don't have the
some
time.
I don't have the time, but then you have to look at, well, what are your priorities? Do you just live with things? I can tell you from having been in practice for 35 years that most of these things just keep getting worse and worse and worse and worse over time. And it's like, it's like putting a frog in a pot of water that's slowly turning up the heat, right? It's like all of a sudden, like you don't realize 10 years, a decade have gone by, 2 decades have gone by, and now like, oh, what happened to my health? What happened to my vibrancy? What happened to why have I put on 40 pounds? Why do I feel like crap? Why am I inflamed? It's because you've ignored the signals for 10, 20, 30
And then
years.
we're going to a traditional doctor because at that point, we just need to numb the pain because we're probably in so much pain that we're at the end of the line where we're like, okay, that's all I know how to do now. I feel like I'm too far gone to even start.
I think a lot of people do feel that way, right?
Yeah.
And a lot of the times I think that people get into that trouble because they've been doing that, like they go to the doctor and it's like, well, here's a painkiller. And then like the next symptom, here's another one. And you turn around and you're my age and all of a sudden you've got 20 different medications you're taking, but you still feel like crap. And nothing seems to be getting better and things getting worse. And then the procedures get more and more invasive as you get older, right? I mean, in the world of like just spine related stuff, if you think of like how dentists have really oriented us around, brushing your teeth every single night for good dental hygiene, flossing your teeth every night, going and getting a cleaning like 3 to 4 times a year, right? Or at least twice a year, right? I'm going 4 times a year. So, but in the world of spine, we've done a really poor job in terms of educating people about spinal hygiene. There's nothing more core or central to you than your spine. When your spine is weak, then you end up with shoulder injuries, you end up with knee injuries and hip injuries because you need the stability of your spine for these lever arms, your legs to pull against.
Yeah.
And so we haven't done, it's like, if you're not in pain, then everything is fine. That's like saying, like, how long do you have a cavity before you feel it? Or if you keep letting it go, then you need a root canal. If you need a that's a surgery, right? So we've done a poor job in terms of educating people around this and like what's proper movement and mobility. And we're also learning more about how to move, like how I was trained 35 years ago in terms of how to move and how to get people to move their joints. Very different than what we know today.
Yeah.
So you have to be in the world of constantly educating yourself and informing yourself. Like if you're relying on what practitioners do is rely on the education they got 20, 30 years ago, and they bring that to what's happening today. And it's like, wait, there's been decades of research that tell us that there's something different to do today than there was and how we're doing something 30 years ago.
So do you think issues in the spine can contribute to just like a variety of health problems that we wouldn't naturally think, oh my God, that's contributing to
Yeah,
my
100%.
spine? Like what's one disease or issue that you're like, I would never think that was connected to my spine?
Yeah, I mean, I think you can look at things like a knee problem or a hip problem or a foot problem can come from a spine problem, but also a foot problem or a knee problem can generate a hip and a low back problem, or a foot problem could be creating a shoulder problem over time because your body is adjusting to that. And the way our body swings through movement is going to compensate for a foot problem or a knee problem, or a hip
Right.
problem. Or if you have a back problem that's causing us, let's say it's low grade, right? You're going to probably compensate for that as you walk. And that slight compensation over time can cause more wear and tear on a joint and then therefore cause another compensation that causes something that seems distal to that.
Right. And then could that affect your organs or the way that your organs function as well?
I guess, I mean, if you have a true pinched nerve, but that's very rare and that goes on for a long time. And that's the old chiropractic story. That's what I mean about like old research. So in the world of chiropractic, you say, oh, you step on a nerve, you cut off the life support to that organ and the organ's going to die and you get unhealthy. It's sort of an outdated model. So what we know now is like very rarely, because I do thorough neurological exams. I've been doing them for 35 years and I rarely see like true pinched nerves. I shouldn't say rarely. I see a fair amount of those now because of what I do with decompression, et cetera. People have been to a lot of the doctors, but in traditional office and when I was practicing traditionally, you just didn't see that much. So the old theory is like, well, if you have a subluxation, which means a misalignment of the spine, it can pinch a nerve and then that's going to cut off vital, life source to your lungs or to your liver or to your heart or to your wherever, right? So that's not really true. So when we adjust somebody, if you have a subluxation, which really just means that 2 vertebrae are just not moving well together. When you adjust somebody, it's causing a massive sensory barrage up into the brain. And that massive sensory barrage up into the brain has a motor output. Right. So you drive input up and then there's going to be a consequential motor output. That motor output change can change organ function. It can change a whole bunch of different things in the body. And it's sort of the basis of functional neurology that we can do things in a way to get neurons to communicate better. that allows the body to function differently, distant to it, right? So the old chiropractic story was chiropractic was founded based upon the principle of a janitor came in who was deaf and got adjusted by this guy, D.D. Palmer, and he restored his hearing. So he thought, oh, I found the cure for hearing. And he adjusted T4. Well, there's no nerve that goes from T4, that's your fourth thoracic vertebra in your spine, that goes into your ear. That's just not how it works, right? And of course, people came in and some people got better, some people got worse. But that's the foundation of it. And yet some chiropractors are still talking about, well, there's a nerve, if I release T4, then you're going to get your hearing back. That's not it. It was a sensory barrage that went up into that patient's temporal lobes that caused sub-threshold firing to now exceed threshold. And now all of a sudden that other.
So it was much deeper than just the nerve.
Correct.
Okay.
Correct.
Much deeper explanation.
It is. It is. It's the only one that's plausible, right? It's all theoretical, but it's the only thing that's plausible right now. Because as I said, there's no nerve that goes there. So, so what I found is that when you're dealing with spine issues can beget other organic issues, but organic issues can affect proper neurological function. Then improper neurological function can then create musculoskeletal imbalances that pile on.
Okay. So yeah, and we can go deeper into that too, and like maybe simplify it even more. But I guess my next question is, what are the most common things that you see people in here for?
So, yeah, the most common, probably number one, are going to be like issues with the low back, like disc herniations, disc bulges, pain in the low back, pain going down the legs, lumps and ting in their legs, loss of motor control in their legs, those kinds of things, right? And then the same thing in the neck, but I'd say that's behind that. I'd probably say like 70% of the cases relate to spine or low back, probably about 30% are coming from the neck. And the same kind of things can happen for people. They're getting lumps and ting, they're getting weakness, maybe they're getting headaches, they have neck pain, a whole bunch of different things like that. And if things are serious enough in the neck, they can obviously be causing lower extremity issues.
Okay, so it's almost like if there's an issue here, that could be causing an issue over here. And if there's an issue here, it could like cause an issue down here. Or
for sure. But we'll break it down, tease it out a little bit. So if you have stenosis in your spinal canal, which means a narrowing down the spinal canal where the spinal cord lives, right? Then that can impact the cord, particularly the front of the cord is what gets impacted most. And the front of the cord is where we have all these motor neurons. So think of your brain and the spinal cord is all this just kind of gets squished together as this sort of electrical wiring that goes down into your body.
And when you say that, you're saying like the tube in the middle of the bones?
Correct.
Okay.
Correct. Okay. Yeah. So you got 24 bones in your spine, right? And they're protecting your spinal cord. So what is the spinal cord? It's literally the output of the brain, the input going back up in the brain, sort of like being squished down into this sort of electrical wiring unit. Okay? The front of the spinal cord are all the pathways going out. So the motor stuff, so the ability to move your hands and feet. So what can happen is if somebody has really bad stenosis in the neck, sometimes and this is the thing I check on every does it, is the first consequence could be getting loss of function in the feet. Okay. So you can start tripping over stuff and going, why am I tripping over stuff? So what's going on there? Like that could be long, what we call motor tracts going down the front of the cord. Could also be coming from low back, of course. Taking that in the other direction, so you can have a low back issue and you can have stenosis, and then that has you leaning forward, and then that causes a consequence of like a mechanical issue of like, well, if you're bending forward, then your head has to be up like this. Okay. Right now you're creating a structural issue at your neck. You can have a structural issue in your neck that causes the forward head posture that then causes a consequence of what's going down your low back.
So it's almost like two highways. And it's like...
From a neurological point of view, right? Yeah. So the motor output on the front of the cord, the sensory coming off the back of the cord.
Okay.
So everything that we feel is literally coming out the back of our spinal cord into our brain. And then our brain recognizes that or interprets that. There's no such thing as pain, really, right? There is how we interpret pain.
Oh, interesting. Okay.
There's what we call nociceptive receptors. So there are receptors in the body that pick up pressure, they pick up light touch, they pick up heat, temperature, all those things, right? And then that fires up into the brain. Think of it like this. Like you have two kids who are running down a gravel driveway. They're 7 years old and they fall. They both trip at the same time and they're twins. One kid is like, oh yeah, right? He's like hysterical and it hurts, right? And the other kids are going, oh, cool, look at that. I got like a stone stuck. I'm like, well, what is that? That's literally an interpretation of the information that got sent from that scraped up knee up to the child's brain, and one interpreted different than the other. It's not to say that, pain is in your head and like, it's not to make anybody bad for experiencing
pain. It's like an objective.
It's a real thing.
Yeah.
It's just it's an interpretation of the receptors, and it's, for some people, it's worse than others,
Oh, that's so interesting. That's a topic that can go really deep down the rabbit hole.
I mean, the whole world of neurology can go down multiple rabbit holes, which is
Yeah.
why it's so fascinating, why it grabbed me, right? Because it's sort of endless. Like I never feel like you fully master it because it's just endless.
Yeah. Yeah. That's so interesting. Okay.
But
So,
like also in the world of like low back issues, like so a lot of what we deal with when we're taking care of somebody who's got like a disc bulge or a disc herniation, we can talk about what those mean. Um, so the discs are acting like a shock absorbers, right? So you have a disc herniation that can literally press on a nerve root and give you pain down your leg.
mhm.
But then you have to ask yourself behind that, well, why did that happen? If it's somebody who like literally just lifted something hard, or even better, they get into a car accident, they get really mangled, they get hit really hard. Your body really isn't designed for that, right? But if you turn around and like lift up like a Kleenex, your back should be able to withstand that. Right?
Mhm.
I mean, we all know people who have like picked up a pen or a pair of glasses and they get stuck. So you have that, oh God moment, I can't move, right? It wasn't the glasses. It was what we call a catastrophic decompensation in the spine, meaning that spine was sort of breaking down over time. And now they had that oh God moment. What I see a lot is like that happened to somebody 30 years ago. And then it took them 2 weeks to get out of it. And nothing happened and they were fine. And then 10 years later, like it happened again.
Mhm.
And then 5 years and then 2 years. And then they walk in here crooked. I'm like, can you just adjust me and get this better? I'm like,
Yeah.
this is something that's been going on for 30 years that you've been ignoring. And now we've got a real big problem here. Now, some of that, there's maybe some vestibular imbalance, meaning the output from the brain was causing an imbalance to the firing of the muscles in the back that's creating instability on one side and then never gets addressed. So I always try to look at that as part of like a treatment protocol. Like, do I need to address that?
Okay, so I'm seeing because I've gone to a regular chiropractor before, and it's like you're taking chiropractic even further, where it's like you're connecting the nerves, the brain function, everything to the bones, right? Because I feel like the chiropractor is just adjusting the bones, and it's kind of leaving out this other deeper kind of root cause reasoning behind why
Probably.
your spine would be twisted.
Yeah, I mean, the way that we're trained in chiropractic is just to find a part of the spine that's really not moving well and then just make it move better.
Yeah.
But any means like necessary, right? Just
Right.
whatever technique you need to do. And all chiropractic techniques work, right? And they work differently. So some people they swear by something that's like a very light touch. And some people swear by an adjustment that's really hard. So for me, for instance, like I do better with a hard adjustment than I don't feel anything soft. The reason that those techniques, all these different techniques work and differently for different people can be explained by neurology and people's metabolic threshold. Like somebody who's got like really like fragile metabolically won't be able to withstand a hard adjustment. Why? Because it's a very powerful sensory input up to the brain. It's a lot of electrical firing. And if somebody's really fragile, it's too much firing and you kind of just smoke out the neurons of those pathways and they're like, oh God, I don't feel good. The old time chiropractors would go, well, that's retracing. Your old injury is showing up. No, that's bad. When somebody passes out after an adjustment, take heed of that. That's not a cool thing. That means you just exceeded that patient's capacity to withstand the amount of input put into their brain. Don't keep exceeding that. That's not cool.
Yeah.
So, but that's like old school, right? So you want to just look at that. And also, when you look at spine function, I don't want to throw my brother under the bus, but we're all trained to like the way that the spine moves. If you bend your head back and forth like this, the spine moves in a couple fashions. So meaning when you laterally bend, there's an element of rotation too. So it isn't just a simple movement, or you can't just right without a little bit of lateral bending. It wasn't until I was like, I don't know, 5 years out of school and I started studying neurology where I went, oh my God, we weren't trained like that. So traditionally we're trained like to adjust something. Let's say you're on your back. Well, bend your head to one side, you probably adjust like this, and they rotate and then they spin your head, right? But that's an uncoupled adjustment. So you want to adjust something in a coupled motion, meaning when you laterally flex your head, you actually want to actually rotate in the opposite direction because that's normal physiological movement. So you can get the release of the spine. It's just, are you creating normal physiological resolution long-term for the patient? And I would argue that if you're doing an uncoupled adjustment, you're not really doing the patient a favor. So when I learned that, I was like, my jaw dropped. And I was listening to Dr. Kara talk about this, and I thought, oh my God, I feel like I've been committing malpractice every day for the last 5 years. Like, I have been not teach this in chiropractic. So this is insane. And it makes sense. So for years and years and years, I took actions of people like their lateral bending like this to see where they were not rotating properly, where there wasn't coupled movement, and then I'd adjust that. I've moved on a little bit from that too, but I always, when I adjust somebody, it's always a coupled adjustment just to make sure I'm doing the right physical. It's also safer.
Yeah.
You're not looking somebody's head around.
So what's going through my mind right now is your journey with your education through, being a chiropractor and then branching off into, what's it called?
Functional neurology or
Functional
neurology.
neurology. Okay. Yeah. So that's like a branch of chiropractic. Is that correct?
It is. It's like a subspecialty.
Okay,
Like just like in the world of medicine, you can go into orthopedics, you can go into neurology or pediatrics. Chiropractic has that same sort of subspecialty.
I see.
But in the world of neurology, Dr. Frederick Carrick is considered the father of functional neurology. It's a whole other game of playing rather than just, we study neurology to a deeper degree. So you get a better exam. It's really understanding how all these things interconnect.
Oh, I see.
What can we do to improve neurological function, not just for the sake of like, oh, I can name that path.
Yeah.
Like, what do you do with that? What do you do with it?
So it's like you're a connector between chiropractic and neurology.
I mean, I guess. So to give an example, like if I see somebody who comes in here and I'm like, this looks pathological, something looks wrong here, I'm sending them to a medical neurologist because they might need steroids, they might need an operation, they might need something else, right?
Okay.
So I'll give you an example. I had a patient who came in here, I don't know, 5 years ago, and she said she was working on something, and literally just sort of like all of a sudden, I know, like just fell over in her face. And she came in, she was bruised, she was messed up, and her shoulder was really killing her. So I'm doing my evaluation of her, and it's like something is not right. So I sent her for an MRI, and she's got a lesion on her spinal cord. Well, when you have a lesion on your spinal cord, like I'm looking at, is this transverse myelitis? Is this multiple sclerosis? That's now sort of out of my league to something like this is an acute thing. So I sent to a colleague of mine who's a really well-trained neurologist in Santa Monica. And he said, you just saved this woman's life because I got her in the hospital, put her on steroids for 3 days. This was a vaccine injury related issue. And right, it was a COVID vaccine reaction. And he got her on steroids and she came back like a year later and she was like, oh my God, thank you so much. That cliff was great. And thank God you found that. So that's the kind of thing where I'm like, well, I'm not doing any functional neurological magic with that person, right? Conversely, I may get somebody from a neurologist or from a GP or somebody who's like all these weird things going on, and there's no pathology shown. They've done the MRIs, they've done the CAT scans, they don't see anything. They've done some like really simple blood work, and they don't see anything. So for those people, we do a really thorough workup and go, well, what's missing? The good news is we can rule out tumors, we can rule out cancer, we can rule out neoplasms, all that stuff. Now, what is really going on with this patient? Because for most MDs, if they don't see something in a picture, it's in your head.
Right.
There's nothing here. Like, hey, you're a malingerer, you're lying.
Yeah.
Or it's psychological.
Right.
Not to say that there isn't some psychology when somebody's in pain and dealing with stuff. There always is. But a lot of times it's just a matter of like digging a little bit deeper and figuring out, well, again, where are these, we talked about this before, like where are these two neurons? Maybe there's just two neurons that aren't talking to each other well. If I can get them to communicate better, then they're going to get a restoration of function. And the cool thing in functional neurology is you often see that like immediately, like in the process of doing an exam, you can go, oh, that thing that I just did work because I saw a change. So it's observation based too, right?
Okay.
Here's another example. I had somebody when I first started doing decompression like 20 some odd years ago. And I believe I was the first person to bring these decompression tables to LA. I was treating somebody and he came off the table and he's like, oh my God, my hip, like I can't stand up. I'm like, well, that's really odd. I haven't seen that before. And so I just did something with his eyes. I just worked on his eyes. There was something that spoke to me about proximal muscle issues, and there was a similar pathway in the brain. And I had him do something called optokinetic strip. He couldn't pick his left hip up. It was like, can't get all I got. So I did this optokinetic strip, and all of a sudden he was like, oh my God, it's still zero pain. Just gone, done. Like in that one thing. So I'm not saying that always occurs that quickly, but when you can look at different pathways in the brain and figure out like what pathways are shutting off motor control, you can have magic stuff like that occur.
Okay. Wow.
And without the
so
training, you'd be like, oh my God, it's still coming from the disc of the low back, and maybe I'm aggravated with no, it was something entirely different.
I'm wondering how much education, say, just in this example, a neurologist has to say, oh, I'm going to send you to a functional neurologist versus a psychologist or a therapist, because they'll say, hey, there's nothing actually wrong.
Sadly,
it's just in your head.
Sadly, not enough. When you establish a personal connection with doctors and they know you and what you're doing. So the part of the problem I think there's two main problems with chiropractic. Number one is, if you're standing next to you, let's say we're in a party together and you're a doctor, you're an MD, and we get introduced. And it's like, hi, this is Dr. Yesenia, and she went to, I don't know, you went to UCLA Medical School. Hi, this is Dr. Ned, where'd you go? I went to Los Angeles College of Chiropractic. Like, there's no weight behind saying Los Angeles College. There's something, the weight behind an institution like UCLA or USC, right? Or I went to University of.
Mm-hmm.
So that's number one. Number two is, MDs, when they go to school, they're all trained very specifically, and they refer to their different sort of subspecialties, and they kind of know the care is standardized. You go to 5 different chiropractors, you get 5 widely different sort of treatments and looks, and it's like, so for an MD, they don't know. They're going to send somebody to a chiropractor who's going to be waving crystals over them, or they're going to be sending them to a chiropractor who's like doing like soft touch or putting wedges under their, and all this works, as I said, or somebody who's going to adjust, or somebody who takes a ton of x-rays, or somebody who just does hole-in-one where they just adjust the atlas and say they're taking pressure off the brainstem. I always laugh when somebody comes in and says that to me. I'm like, if somebody's taking pressure off your brainstem with an atlas, you have bigger problems, because your brainstem should not be in your spinal canal. It should be above your skull. But it's those kinds of things, I think, that prevent MDs often from referring to us. So typically when I meet them and we talk, they're like, oh, you're not like most chiropractors. Right.
Okay. Wow. There's so many facets to this, and there's just so many different pathways and different education and knowledge of, because none of them are like maybe less credible. It's just like a different pathway, different sort of like education that leads all back to, I guess, the totality of a human body and how it works.
Right.
It's very interesting.
It is. It's super interesting. And a lot of times people will come in here and it's like, I do a full neurological exam. I'm like, I see why the MD like didn't find anything, because there's nothing here to find.
Yeah.
So now we look at, well, what's going on underneath the surface? Now maybe we're looking at like different blood tests, or we're looking at different sort of subspecialty tests. Like, do you have a parasite? Do you have some sort of dysbiosis? Or do you have a heavy metal toxicity? Do you have a mold toxicity? Do you have an environmental toxicity?
So you have knowledge in those areas too, because I feel like I'm just calling them regular doctors, for lack of a better term. Regular doctors. You don't hear them talking about parasites and maybe even like diet and nutrition as much,
Oh, for sure not.
Yeah.
It's not their world. I'll tell you a funny story. So about 5 years ago, I was working with a gastroenterologist, and I brought him I had done a stool test. I do one every year. So I brought him my stool test just to see what he thought. And he's like flipping through the pages. And he goes, to be honest with you, he goes, I don't understand like the first paragraph. He goes, I should probably go into and study functional medicine because it could probably help more people. He goes, but I do like 50 colonoscopies a month. I don't really have the time for this. So doing a weekend, I know wouldn't do it justice. He said, do you know that they don't even have candida in the textbooks in medical school? Right? Even like everybody knows about candida. Like literally you talk to anybody like candida, it's a yeast problem. It's not in the medical textbooks.
Yeah. And not everyone knows about candida. A lot of people who have gone to doctors, had issues, it wasn't solved, then they start their own health journey, and they start reading all different sorts of things and trying to piece it together and heal themselves and go to this doctor and go to that doctor and try this cleanse and that detox. And then
they
it's
get on
just
Google.
this crazy journey. Yeah. And then they get on Google, and we're definitely all on our own journeys of healing and becoming aware of our bodies and figuring out what we need. And then we find people like you who've gone, really deep into one area that could like help us heal. But I think the disconnect is, the disconnect in general from our own bodies and understanding what we need, and then the knowledge out there to know all these different sorts of doctors and what they specialize in, so we can actually direct ourselves on the right journey to healing.
Yeah. I think I heard one of my colleagues said this like 15 years ago. I was like, I'm going to use this so great. He goes, I don't want to be the best specialist in the world. I want to be the best generalist. I'm like, oh, that's brilliant. I'm going to always use that. Because when in the traditional medical model, you go to specialists. So you go to see a neurologist, they live in the world of neurology, right? You go to a cardiovascular specialist, a cardiologist, they live in that world, right? You go see an endocrinologist, they live in that world. You go see a pain management specialist, he lives in that world. And that's not how our body functions, right? We all go to school, doesn't matter whether you went to osteopathic school, chiropractic school, medical school, we all learn these different systems in the body. But the reality is all these systems work together. Like the study of psychoneuroimmunology is exploding right now, right? So all these systems work together. And if you don't look at somebody like that, you don't look at them as an integrated human being, but what system is affecting what, your gut microbiome can affect your skin. You go to a dermatologist, all they're doing is topical stuff.
Yeah.
Right?
It's like they're so zoomed into the problem, they miss the bigger picture. So that's what you're saying with that. You want to be the generalist.
I want to be the generalist, so I want to be able to go like, okay, step back. Let me look at everything, right? The cool thing is that Google now allows people to have like unimpeded information. The bad news is like, well, you're not trained, so how do you siphon through what's real, what's not real, what's false, what's just marketing, what's really so,
right?
And what's the quickest route to getting you well? And as you mentioned a little bit ago, like healing is a journey, right? It's a process. There's no like Injuring yourself is an event. Heal. It doesn't matter what you're healing from. It's a process. Typically, you don't just heal like that, right?
Yeah.
But if you fall down a flight of stairs, that's an event. Surgery would be an event. A car accident is an event, right? A sports injury is an event. But it doesn't matter if you're the best athlete in the world. You got $1 million like trainers behind you. Your body, your tissue still has to go through a healing process.
Yeah.
This does. Now, those athletes have things like this device here, like this software device available in their trainers' rooms, right? So they have things that help accelerate the healing process that isn't available to the general public, which is why they can get back on the field. They need to, because they're paying these guys $100 million a year or whatever they're paying them, these crazy salaries, right? They got to get them back out on the field. And so they spend a lot of money to make sure that they're keeping them healthy. But at the end of the day, we want to have all of us be as healthy as that, right? But also, athletes are incentivized because they make a living with their body. This is their instrument. A lot of us sort of just take this for granted. In the biology, it's both fragile and incredibly resilient, right? Like our bodies take a lot of punishment. You see people who just eat like crap, don't take care of themselves, never work out, right? Just aren't taking good care of themselves. Maybe they smoke, they're drinking a lot. And yet the body persists, right? For a number of years until maybe it crashes.
Yeah. Our poor bodies.
Our poor bodies, right? And at the same time, there's also like a fragility where some people, it's really about our genetics. A lot of this is about our genetics. So we used to think like if you had a certain genetic predisposition to something, that was your fait accompli. Like if you have a predisposition to diabetes, well, then you're going to express diabetes at some point in your life. We now know that that's BS. So genes can be turned on and turned off based upon the environment that they're exposed to, which is called the study of epigenetics. So that's the basis from what Tom was. It was like, well, what things are in your body? Like if you come to me because you've got a thyroid problem, or because you've got, your diabetes, pre-diabetic, or you've got autoimmune conditions, or you've got gastrointestinal issues. It's like, okay, so you may have a genetic expression of something. Well, how do we turn off that genetic expression? What is getting into your body? What's messing with your system that's causing your genes to express in a certain way that doesn't make you feel good? And oftentimes it's complicated. Oftentimes it's relatively simple. It's just a simple exploration of, let me listen to your symptoms. Let me do an exam. Let me see what makes the most sense. Let's test that. Let's start eliminating that from your body. And all of a sudden people start going, oh my God, I'm so much better. With diabetics, it happens so rapidly. We get people off their medication. It's crazy. People start dropping weight. So let's use the world of diabetes. So in the world of diabetes, so many people go to their doctors and they go, exercise more, eat less, lose weight, and then you'll reverse your diabetes. And it's exactly the opposite. Get your metabolism straightened out. Figure out what's causing the obesity, and then the weight comes off of you, the fat comes off of you. It's just done in reverse. And I got patients come in, they're like, man, I stare at a salad bar, I walk 3 miles, I got on the scale the next day, and I weigh 3 pounds more. What the hell? What's that about? And I've seen women like this too, with, quote unquote thyroid issues. This happens all the time. There's a lot of things underneath the surface that will drive that experience for patients. And if you're not looking at that, you could be banging your head against the wall and never lose weight. Like if your insulin levels are too high, insulin is a fat storing hormone. You're not going to lose weight if your insulin levels are sky high. You're just not. So telling somebody to just exercise more and eat less, which like for some people it's like, how could they eat less, is the exact opposite of what they need to be being told.
Yeah.
As an example, like for a lot of people who have like heartburn, right? What's the first thing they reach for is antacid. I'm going to say that probably over 80% of the people that I see with this actually have a lack of acid, not too much acid. So you give them acid and their problems resolve. They're like, what in the world? How does that happen? It's because doctors aren't paying attention. It's just a reflex. Oh, you have this, I give you that. Rather than testing seems.
I'm seeing so many, I think, stories that we've been told in the past about our issues or disease. And of course, one of the stories, right, is just, hey, let's numb it, whatever the case. Or like this example that you just said about the antacids. It's like we're doing the opposite, and it's not causing the problem, or it's not solving the problem. So it's like all of these stories that we have to go into, because I'm seeing so many different things that we could talk about and so many different questions that I have. It's like going into these stories and solving these myths, or what we've always thought to be true, unraveling that and bringing in functional neurology to solve a lot of these problems.
Functional neurology or functional medicine or what? It's just looking at the physiology again and looking at what's going on, right? I mean, look, by the time we're 50, most of us have about 50% of the acid production in our stomach than we did when we were in our 20s. Well, either you can do things to actually improve that acid function, or you just got to supplement with it, right? So I have a friend of mine who came to me about 7 years ago. He's a very wealthy person. He has something called Barrett's esophagus, which is a really bad scarring of his esophagus. So he was literally eating like protonics and eating all these antacids all day long. And he was refluxing food up at night, even with this, like literally like food cold. It's so unpleasant, so miserable. If you've ever experienced heartburn, like it's not fun to feel all that acid come up with food, imagine, right? And so I did a couple tests on him. I said, let's just back off of that. And let's start giving you some acid. He's like, are you kidding me? I said, no, let's just start giving me some hypochlorite acid. He called me in like a month. He goes, you're a freaking genius. He goes, I seem like the best people over here at UCL. I said, I'm not a genius. He goes, why has nobody ever told me to do that? I haven't had like a reflux like pain symptom for a month now. 6 months later, he said, I've had one episode and it's because I eat pizza every night. He goes, I did it to myself. But I'm not like zero reflux anymore. Now, had he been doing that years ago, he probably wouldn't have even had a Barrett's esophagus. I was saying that there isn't a time and a place for an antacid, right? You have an ulcer, and you don't put acid someplace. But it's just things like that that seem that are, for me, are sort of like common sense, that for most people are not, because we've all just been trained. Look, by the time you're like 13 years old, you've seen something like 400, 500,000 total pharmaceutical commercials. You think that if you have a stomachache, the solution is Pepto-Bismol. Because you just, it's imprinted. It's like a brain flooding. Your brain doesn't even stand a chance. You're like, that's of course what I do. I have a headache, I take an Advil.
Right.
Well, what's the headache coming from? Is it a food allergy? Is it food sensitivity? Is it a structural issue? Is it a light issue? What is it? Why do we just acclimate ourselves to like, I just keep popping pills just to knock that down?
Yeah. I wonder if there's like a quiz that we can do to be like, because you just went through those different stuff. Is it this? Is it that? Like to help us find the right healer. I say healer, doctor, to help us with these problems.
I don't know if there's a quiz to do that.
Well, I think you're almost doing it in your mind as a doctor when you're trying to figure out how can I help this person? Do I have to refer them?
Correct.
So it's like maybe there's something that we could create for the clients, for people to kind of go through those steps
And in
to
general,
even find you,
Yeah, I don't know. I don't know what that looks like. I'm not creative enough. Maybe you can figure that out.
Well, I mean, yeah, I feel like we're naturally kind of going through that, as we have this conversation. And another thing I thought of, so what is the journey with you? Like as a patient, if I come to see you, am I going to see you forever? Is there a journey to kind of dismount from you and be like, hey, my time with the doc is over. Now I can kind of take the healing in my own hands?
Great question. So unlike probably most traditional chiropractors, I guess it depends on what you're coming in here for, right? I try and like get people well, teach them how to stay well, and then maybe use me as maintenance every now and then. Not like, oh, you got to be seeing me 3 times a week for the rest of your life. Like that's no.
Great.
So it, again, depends on like if somebody comes in and they've got like a disc herniation or a disc bulge as an example, I may treat them for a couple of months and then, pretty intensively 2-3 times a week. And then after that, maybe they're coming in like once a week or once every 2 weeks. And then it's once a month and it's once a quarter. And then it's like that. Right. And again, depends on the age of the patient, how severe the degeneration is in their spine. Again, because it's a little bit like we were talking about like healing's a process, right? So if you're 60 years old and you haven't taken care of your spine and you have degenerative disc disease, and I'm doing decompression on you because you blew a disc out and you have a disc herniation or a disc bulge, we're going to get you out of the acute stage. But if you don't maintain that over time, you're going to degrade. It's sort of like saying, I go to the gym. Do you go to the gym for 2 months straight and then never go again for the rest of the year? It doesn't make any sense, right? Or I ate really good for 2 months and I lost 20 pounds. And I went back to eating marshmallows and Oreo cookies and Ritz crackers every day. Well, okay. And what happened? I put 40 pounds back on. I have to do some level of maintenance, right? When it comes to the world of functional medicine, I will treat people typically for a few months. Maybe it's once a week, once every couple of weeks. And then we're trying to get their physiology straightened out as quickly as possible and then train them and teach them how to maintain this and how to do this on their own. I still do think that doing like a really, thorough blood test at minimum twice a year is the right thing to do. Like it's clearly a failed experiment. This whole like idea of like one physical a year, your yearly physical tells you if you're good to go. It's just BS, right? It's such, most of these tests are what we call like a wasted poke in the hole in your vein. They test so few things like you don't even know. They're just looking at high points. So for instance, like somebody like who's got a thyroid issue, doctors will often run like your TSH, thyroid stimulating hormone, and maybe your T4, right? Maybe your T3. But there's 12 tests you want to run to look at absolute thyroid function, with thyroid physiology. So your thyroid could be functioning well, but there could be things that are causing a breakdown in the hormones downstream that if you're not running all the tests, you never evaluate, you never look at. And then you see the breakdown of those hormones downstream, you have to look elsewhere and go, well, what are the things that impact that? Is it a liver problem? Is it a gut problem? Is it a toxicity issue? And that's how you unwind that for people, right? So this annual physical, I know so many people who are like, they're annual physical, and then all of a sudden they develop cancer 2 months later. But did they really develop cancer 2 months later?
Yeah.
No, it was missed in the annual physical.
Yeah, it was already
Right.
it was already in the plan
Of
there.
course, it was already in the plan.
Yeah.
So the genetic expression was expressing that gene,
Yeah.
right? So when we run blood tests, because what we're looking for is not just pathology as a functional medicine, but I'm looking at patterns of things that are not working well inside that patient's body. Well, the only way that you pick up patterns is you have to look at more markers to go, what are the patterns here, right? So like it or not, when we do blood tests, we're looking at probabilities. It's not like an exact science. It's a probability, because if I ran your blood work, you're sitting at like 8 in the morning, and I ran the same blood work at 5 p.m., some of those markers are going to look different at 5 p.m. than they did at 8 a.m. So again, the more things that you look at, the higher probability you have of picking up patterns and things that are sort of going the wrong direction. We don't want to wait until you're inside or outside the lab value range, right? Because that's the way most doctors look at things. Like, as long as you're inside that lab reference range, you're totally fine. Really? So
Right. And then you go home and you're like, no, there's something wrong with me, but my lab said everything was good.
hear it all the time.
Right.
Doctor said my labs are normal. And you look and you go like, so let's just say, as an example, your hemoglobin, your hematocrit, and red blood cells are on the low end of normal. You can be considered normal. You're not anemic. But for you, that might be causing your fatigue and your anemia, because your hemoglobin is low. That's what transports oxygen around your body. But in the world of traditional medicine, sometimes it's like, oh, well, you're fine. You're in range. No, I mean, there was a period of time I went through here where I was just seeing anemia over and over and over again, and like nothing was being done. I remember a patient saying, I've been with my doctor for 20 years. Like, why is he not taking this? So I don't know, but you literally says red blood cell low, hematocrit low, hemoglobin low. Your primary concern is you're exhausted. You can Google this. This means you're anemic, right? Now, do you have a macrocytic anemia? Do you have a microcytic anemia? Do you have a hypochrome? Those are things that we look at as doctors to determine what kind of anemia you have, because they're not all iron-based. But those are the kinds of things that you need to be looking at thoroughly and staying on top of, and making sure that you're not just waiting for something to fall off the range. So if somebody's A1C is, 5.7, so you're just on the cusp of being pre-diabetic. Well, we'll just wait until you're diabetic before you do something.
Right.
Really? Why not intervene now and start to reverse it? Because even the American Diabetic Association says it will cause irreversible neurological damage when we're in the pre-diabetic state, let alone diabetic state. So, yeah, you want to look at patterns. You want to look at things that could be, again, things that are interrelated. And if you're just doing spot checks to go, as long as that person doesn't have like a tumor that out pathology, I don't need to do anything about it.
Yeah, I think it's like changing the patient's perspective around healing, because we have that instant gratification idea because of marketing, because of, how we've dealt with issues and disease before of, hey, let's just pop a pill, everything is good. It's changing that perspective for the patient of this instant gratification, and then laying out the healing journey and showing a patient like, hey, this is where we're at, and these are the steps that we need to take to get you back to alignment.
My experience is that most patients are looking for that now. My experience is that patients are really sick and tired of the medical model of like a drug to fit a disease.
Because they've experienced it and they
They've
know that it's not
experienced
working.
It's not working for them. They don't feel good. I think the stop for a lot of them is that functional medicine can get expensive for patients, right? A lot of the testing that we do isn't covered by insurance. But then you have to really weigh out, well, what are your priorities? Like, what are we spending our money on? I was at a conference, it was like 25 years ago. It was really funny. It was like 2,500 people there, right? The guy at the head of the room, he goes, I want everybody to pull out a piece of paper, fold it in half lengthwise. Because on the left side, I want you to write down the top 10 things you value most in your life. So people are writing family, religion, spirituality, health, right? They do all that stuff. So he gives us like a few minutes to do that. He goes, okay, now on the right side, I want you to write down how much money you spent on each one of these things that you value the most. You're already laughing. So like within like 30 seconds, maybe less, like 10 seconds, people are having their aha moments and laughing because you say, I value like my family the most, but I spend the most money on toys.
Yeah.
Right? I want my jet skis and all about so vacations, right? What are we valuing in life?
Yeah.
And I can tell you, because I have gone in and out of like being healthy and not being healthy throughout my career too, just even helping people, and relationships and bad marriages have an impact on that too. Like we just stopped taking care of ourselves. And I can tell you that when your health declines, you don't have the same mental clarity. You don't feel you have the energy. Like life just has sort of like gray sort of umbrella over you, and you're not thinking clearly and you don't feel well. When you regain your health, it's like all of a sudden life becomes vibrant again. Everything feels great again. And like, relationships, everything just seems to get better. Like it snowballs into that. So patients get daunted by like, why isn't my insurance covered? I don't know, but like, what's more important, that your insurance covers it? Look, I pay $1,800 a month for insurance. It's staggering. For what? It doesn't. It's so that if I were to have a heart attack or a stroke, I don't go bankrupt.
But I think honestly laying out the journey and possibly putting some sort of like average price on it, because when I go to a functional doctor or a chiropractor, it almost feels like out in the ethers, like how much money I'm going to spend on healing this. Like I don't feel like there's an endpoint, and I feel like I'm just like dumping money into a
Yeah.
bucket.
Yeah.
So I'm wondering if there's a way for patients to kind of see a path and how much that could possibly cost, not like a definitive answer, and then how they could kind of like chunk out that in payments, or how they could actually afford it. Because if I'm going to go to a doctor and they're like, hey, this is going to cost you like 10 grand, I'm just going to walk out and be like, F it. I'm just going to keep popping Advil. It's cheaper. You know what I mean?
It's cheaper in the short term, but long term, you're going to pay the price. And what's the
Right.
cost to your life and the quality of your life?
And I think people
understand.
understand that concept. They just don't know how to pay for it.
Totally get
You
it,
know what I
totally get
mean?
it.
They don't know how to break it down.
So
They don't know
I
how to
think,
make it fit into their life, like insurance, right? Like I can pay a monthly amount for my health, and eventually, hopefully, I can get healthy and better, but I still have to pay for that insurance
yeah,
payment even when I'm healthy.
yeah. I mean, it's the double. It's sort of like you're paying for insurance is from this thing over here, but we shouldn't call it health insurance, because the health insurance that we have is not health insurance. It's crisis care insurance.
Right.
It's got nothing to do with your health. Really, let's stop lying to ourselves. It doesn't have anything to do with getting your health. We have an amazing acute care system. So if you split your head open on the sidewalk, or you have a stroke or a heart attack, our crisis care system or our healthcare system, which is really quick, is amazing. Like you have a better chance of being kept alive in that. Like I'll give you an example. So my brother is a diabetic. Every single male in my family has been a diabetic and had heart attacks and died of heart disease. I'm the only only male in my family who at 63, no heart attack, no nothing, no like not diabetic. That's not going to happen. That's not because I've just surrendered to it. It's because I fight actively against that. Make choices, right? So a number of years ago, my brother had a heart attack, and it was probably 2 weeks before. I'd been staying at his place, and he's on the East Coast. I'm staying at his place, and I walked out to get a cup of coffee in the morning. I saw on the fridge a prescription bottle. So I'm nosy. I look at it. It's my brother's name. And it says metformin. It's first line diabetic medication. My brother comes and I go, bro, how long have you been a diabetic? He goes, I don't know, like 6 or 7 years. I'm like, how come you don't tell me? Because I don't want to bother you. My doctor's helping me. What do you mean he's helping you? You're on medication? He goes, yeah. He says he's happy. It's in control. Like my A1, asked him what his A1C is. It's like a 7.5. I go, that's good? No. You're still a raging diabetic with this. You're on a statin drug, of course. You're on blood pressure medication, of course. All that stuff. I said, listen, I don't want to raise your kids. I go, when he goes, what are you talking about? I go, you're 60% more likely to have a heart attack or a stroke as a diabetic than I am. 2 weeks later, he has a heart attack. He lives like across the street from the Duke. So it's like, he's like in there in like 2 minutes. He goes, it was like a military operation. I got him up with they put a stent in his heart, did all this thing. The next day I'm in the recovery room with him, and the nurse comes in to give him all the insulin. I go, what are you doing? This is what got him here. And he's like, let them keep me alive. He's scared. Let them keep me alive, and then I'll do whatever you want me to do. But that's sort of like, that's the path of what goes on. If people just sort of like, they just get resigned to, oh, this is how it is, right? And you've got to take active steps to move away from that. So unfortunately, some of the testing, like blood tests, often can be covered by insurance, right? Some of the testing can be. Some of the more advanced testing just is not. It just isn't. So you have to, again, determine what your values are, right? What's important. We don't want to over test. We don't want to run tens of thousands of dollars of tests. So we want to have a good consultation with you and figure out, well, what do I think is the most likely culprit here? Oftentimes we run a blood test first, because that will give us a better picture of what's going on underneath the surface than almost anything else we can do. And then based upon that, we can say, okay, well, let's run that specialty test. Let's run that and see if that's the thing that's causing the issue. And then there's dietary and lifestyle interventions, and then supplements based on testing specific to your thing, not just here, take a bunch of these things. It's based on what your labs are telling you.
Yeah.
And then you go from there. And then we train you to understand how these things are impacting your body and how to make good choices for yourself. And then it's up to you as the patient to make the right choice for yourself, right? We can't hold your hand. There's some psychology that needs to be overcome in that, right?
Mm-hmm.
I mean, a lot of people that we see that are like in their 60s and 70s, like their marriages aren't good, they're not feeling good. It's a way to self-medicate. And back to full circle to what we were talking about before is a lot of people don't want to feel anything, right? They want to just shove it down, push it down. And sometimes getting healthy means revealing some of that underlying stuff that we're doing to ourselves, right? Because it's self-destructive, but it's really you don't see it as self-destructive. You see it as like, I'm just trying to manage, and it's a strategy to like keep my pain away so I can sort of psychically deal with my life.
Yeah. Yeah.
So sometimes those things need to be dealt with too. I would say probably in the world of my thyroid patients, I would say probably 90% or north of that would be helpful for them to be seeing a therapist as well.
Wow. There are so many things that we talked about today that, I mean, we could go down so many more rabbit holes. It's been very enlightening. And I just want to thank you for the conversation. And I definitely want to
Thank
come
you.
see you
Appreciate it.
again and talk more. And I'm sure once I go home, I'm gonna have so many more questions for you. So I
I'm
would
here.
love to do
I'm
it
here.
again.
I'd like to do it too. Thank you
Okay.
so much.
Yeah.
Appreciate it.
Thank you.
Thank you.